Hi, I'm Kayla from CMV Canada, and we believe now is the time to screen for CMV. We know that congenital CMV is extremely common, and yet most cases are not being diagnosed. And this is a big problem because we're missing the opportunity to treat these kids and to offer interventions that could potentially drastically improve their outcomes. We also know for a fact that universal screening works because since 2019, the province of Ontario has been screening every newborn for CMV at birth. And the program is doing very well. They're saving babies' lives, they're ensuring these kids have the best outcomes possible, and that's what it's all about. So talk to your local legislators and let them know it's time to screen for CMV.
It's time to start screening for congenital CMV because early detection is so important and can make a difference in the outcomes for kids affected by CMV. My son was born in 2018, just before universal screening began in our home province of Ontario. We learned he had congenital CMV, and it was the cause of his permanent hearing loss. Had we known from birth that he had CMV, we could have started the antivirals right away and potentially prevented the profound permanent hearing loss.
CMV Action UK commissioned research in 2018 into the economic cost of congenital CMV. Our research identified the most common impairment resulting from congenital CMV is sensorineural hearing loss. The research estimated the range for the total cost for children affected in this way in the UK is between £130 to £181 million per annum. At CMV Action UK, we believe that universal newborn screening would pick up those children at risk and significantly reduce those costs.
In 2017, the UK Screening Committee rejected newborn screening of babies for CMV. And one of the reasons cited was that more research into saliva testing is needed. However, we believe from a number of research projects into low-cost, extremely effective saliva testing that we're currently being involved in, that this evidence will soon be available.
There have been significant advances in diagnostic technology and treatments for sensorineural hearing loss in recent years. So now, more than ever, universal screening for newborns would enable affected children to receive treatment much, much sooner, as well as picking up those that are currently missed, saving both money and heartache. This is equally true of some of the other conditions associated with CMV, but not always apparent at birth, and this will enable better monitoring and better treatment.
As a charity, we support families that have had a late diagnosis of congenital CMV. Sometimes this is after their child has started school and concerns are identified. This can be a stressful time as diagnosis is via the dried blood spot test. Although families are relieved to finally have a diagnosis, they are upset that opportunities for treatment, hearing checks and monitoring have all been missed. As the COVID pandemic has meant that babies and children have less face-to-face appointments, it's likely that late diagnosis will continue to be an issue. Many of these parents ask us why there is no screening for newborns. With screening, these late diagnoses and missed opportunities would be avoided.
Hi, I'm Susie from CMV Action UK. Currently, babies who fail their newborn hearing test should be tested for CMV, and if positive, urgent consideration given to treatment with antiviral medication to allay further hearing loss. However, treatment needs to start within the first 28 days of life for optimum effectiveness, and we know, as an organisation helping families affected by CMV, that this window of opportunity is often missed. Universal screening would remedy this problem.
Hi, my name is Corey Clem, and I strongly support newborn CMV screening. If it hadn't been for the doctors who diagnosed our own daughter, Ellie, at 3 days old in the hospital, we would not have received her hearing aids as early. We would not have been able to start her antivirals. And in our experience, her early newborn identification of CMV was what made all the difference into our lively, talkative 20-month-old that we have today.
Hi, I'm Emily McDonald, co-chair of the Associate Board at National CMV, and this is 7-week-old Hadley, who was screened for CMV in the hospital upon request. Now is the time for all newborns to be screened for CMV to ensure parents have the knowledge they need to support and protect their babies.
Hi, my name is Kara Gluck and I am an Alliance Chair for the National CMV Foundation. I support universal newborn screening for congenital CMV because we need to identify these newborns early so that we can get them treatment and intervention early This early intervention and this treatment will allow them to have the greatest success in life. My family was impacted, and had we known, we would have been able to make better decisions. Newborn screening saves lives.
CMV can sometimes be seen as just another thing for new parents to worry about. However, parents are well informed about screening tests that the babies have from birth for the first few weeks of life around a range of conditions, and they are accepting of these because they know that the best is being done. An easy, uninvasive saliva screening test for CMV, we believe, would put parents' mind at rest and know that the best thing is being done for their baby.